Cases of syphilis are on the rise in Florida, and tonight we're verifying if pregnant women can pass it on to their babies. Our Heather Crawford joins us now to separate fact from fiction.
Well, Anthony, syphilis is a sexually transmitted disease that can be cured with antibiotics. But if you don't treat it and you get pregnant, can you pass it on to your unborn baby? Let's verify. Our sources, Dr. Sunil Joshi, the City of Jacksonville's Chief Health Officer, Chad Nielsen, an infection prevention expert, and the Florida Department of Health. Dr. Joshi says, yes, a mother can pass syphilis on to her baby during pregnancy.
And you definitely can. In fact, if you have syphilis as a pregnant woman and you have not been treated for it, untreated syphilis, the chances of passing that on to your baby during pregnancy approaches 100%.
And congenital syphilis can be deadly.
There's about a 40% chance that baby will be a stillbirth or die in the first year of their life.
It could cause a spontaneous abortion of the baby. It could cause uterine defects of the fetus. It could cause all sorts of issues.
That's why they say it's important to know your syphilis status and to be treated if you have it.
Good adherence to safe sex practices and proper testing and treatment can eliminate this. But unfortunately, we're not seeing that. We're seeing rising numbers of syphilis amongst adults in Jacksonville, as well as congenital syphilis, which means people are actually carrying syphilis and passing it on to their unborn babies.
The latest data from the Florida Health Department shows in 2022, the congenital syphilis rate in Duval County was more than double Florida's rate.
Newborns with syphilis is also on the rise. In fact, 275 out of every 100,000 live births have syphilis.
So we can verify, yes, a mother can pass syphilis onto her baby during pregnancy. The Florida Health Department says to protect the baby, women should be tested at least once during their pregnancy.
But congenital syphilis is one of those things that we very rarely talk about, and we need to promote the importance of being diagnosed early and treated during pregnancy, because that's another way for us to prevent stillbirths, but also death in the first year of life with our babies.
Now, keep in mind, you can have syphilis without having any symptoms, but signs of this sexually transmitted disease in adults include a single sore or multiple sores. They usually last 3 to 6 weeks. Sores are usually firm, round, and painless. And even after the sores go away, you do still need to be treated in order to stop the infection. And if you have something you'd like for us to verify, email us at verify@firstcoastnews.com. With your Verify, I'm Heather Crawford.